And welcome back. Here we are with unit number 3, Student Evaluation in Clinical Education. Again, we'll be moving right into this material as we've been going through most of the material all morning. Objectives are to assess nursing student learning and performing in the clinical setting. And this is referring to both the formative and summative evaluations and providing specific feedback. And it's the specific feedback that you as a DEU nurse is so able to offer to students, and it carries a lot of significance for them to get that kind of feedback in the clinical area. The other objective is that you will participate in benchmark nursing student progress in the clinical setting. And we will be talking about the progressive clinical evaluation tool in addition to the generalities of clinical evaluation. So evaluation really is making judgments about the learning and performance. And it's important to keep in mind that I think generally when we think about evaluation, we think about what is the student doing, how are they performing? But we also need to be aware of what is the student learning and how are they growing as a result of this experience. So clinical evaluation is really not the same as grading. It's making our observations of the performance. And we're going to look at some of the goals of clinical evaluation, such as is the student meeting the course outcomes or the objectives or competencies. Now, you'll have access to the Google Doc that has the competencies and the characteristics that we need to evaluate. So that's where you're going to be taking this evaluation process ultimately. Types of evaluation: the formative evaluation occurs throughout the whole rotation. And it's the formative evaluation that will help improve learning and achievement. Formative evaluation is usually not graded, however, it is evaluated, and oftentimes we will evaluate using a 1 to 4 grading scale, not grading but evaluation scale. Now, summative evaluation is when you're summarizing what the students have learned, and it will relate to whether or not the course outcomes and the competencies have been achieved. Ultimately, a grade is assigned, and what we see in our clinical evaluation is one of three grades that could be assigned: satisfactory, or satisfactory progress, needs improvement, unsatisfactory. And the summative evaluation is completed at an end point in time. For us, that means that it will be completed at midterm with the first rotation of students, and it would be completed at the final end of the semester for the second rotation students. It's completed by the DEU faculty. However, you as the staff nurse instructor contribute information on student performance. And once again, it is your contribution that seems to carry a lot of weight with the students, because they recognize that they're being evaluated by someone who is performing these things on a regular basis and knows their stuff, quote unquote. So the contribution from your end then is to provide specific feedback to the students, and once again that will include both positive and negative. But the negative will be phrased, as you know, in such a way that it's acceptable and it carries meaning to the student. And this contribution is essential to learning, and it's helpful if you can include the student and say, this is how I saw it. How did you see your performance? And then you can go from there. Now here we're talking also about precise, specific feedback, and identifying learning needs and then how to meet them. So organization is oftentimes a difficult area for students, because many times they're only caring for a portion of the needs required by a client. They maybe don't have the whole gamut of assessment, documentation, medication, teaching, treatment team. They have a portion of that. So when we're evaluating that, again, to say your organization needs to improve, that really doesn't indicate what the problem is or how it could improve. And so what would be much better would be to say there were some areas that you could improve upon, one of which is organizing your day so that you can achieve the things that you needed to achieve. So again, how you state the feedback is really significant. Now, the formative evaluation, again, is verbal, and the students tend to accept that. It's more personal. It feels more like a discussion. The written is also occurring, and it's usually noted on the evaluation form, and it is definitely related to the verbal feedback. Maybe it's summarizing the verbal feedback. Formative evaluation should be done promptly, given at the time of the situation, of the learning situation, or shortly thereafter. And again, keep in mind that students need varying degrees of feedback and positive reinforcement, and chances are you will work with the student for a few days and you'll recognize what they need and how often they need to hear it and what they can tolerate. As they become more confident, they are better able to assess their own performance. However, that growth probably won't be occurring as readily as if you are giving them frequent feedback and helping them learn to assess their own performance, because oftentimes they don't have a benchmark for recognizing what they did well and what could be changed. Formative evaluation, again, no one likes to be told in public and for others to hear, so you want to be sensitive to that. Take the student aside as you can to give them some feedback on the spot. The steps in giving feedback, again, is to review the outcomes that they need to achieve and set the stage. To set the stage, you can say, I want to give you some feedback on the medications you passed, or on your injection technique. I want to give you some feedback on the way you conducted your assessment, or the conversation or the teaching that you did with your client. Again, this is an opportunity to include the student in the process by asking them, so what went well? What did you do well? And what needs to improve? From your point of view, what are some areas that you could maybe do better with or could grow with? And again, sharing specific observations is very helpful with specific examples, and recommend ways to improve. Specific things like do your charting within X amount of time, or after giving a PRN, remember to follow up with your client to assess effectiveness within X amount of time, so that you're tying in expected behaviors and giving them that feedback so they know what's expected of them. Now, evaluation of specific outcomes typically relates to the course objectives, and they are leveled throughout the curriculum. And so we've got some examples here of some of our objectives. Evaluating culturally competent nursing care with clients. And so then, obviously, those would be outcomes related to caring and cultural competence, but then we'll also have creating and analyzing alternative solutions based on scientific and or humanistic rationale. So here's where critical thinking comes in, and management of responsibilities. And once again, when you're looking at the objectives, you probably don't recall them verbatim, but you probably are pretty quick to identify areas where the client or the student was doing some critical thinking in planning care, or was figuring out how to plan their day so that they could best manage the responsibilities of caring for their clients. So our progressive clinical evaluation tool has these categories: caring, cultural competence, communication, clinical knowledge, critical thinking, management of responsibilities, nursing process, professionalism, safety, and technology. Now, you probably won't have the opportunity to address all of those categories, and in fact, I wouldn't want to overload you in that regard, but there are many that you would be able to reflect on over the course of a day. Certainly communication, because you'd be seeing them communicate with the client and with you and with others on the treatment team. Clinical knowledge, by asking them about their knowledge of the symptoms, of the illness, of the medications and side effects, and maybe critical thinking. If this happens, what happens next? What lab work do you need to look at in order to successfully treat the client with this medication? That sort of thing. Management of responsibilities is if they manage to get the things done that they were responsible for over the course of the day, whether it's a morning assessment or doing a CWA every 2 hours, whatever those things may be, that's the responsibilities that you would be responding to. Nursing process, that may or may not come up in your day because, of course, we know that nursing students are always making care plans and doing the nursing process. While in the unit with a DEURN, they might be looking at particular aspects of the nursing process. What are the assessments that we need to see to recognize improvement or deterioration? What are the interventions that you would offer to help promote rest and relaxation for this highly anxious client? Those kinds of things where you're using aspects of the nursing process, but probably not putting together a whole full-blown care plan. Professionalism is pretty easy to spot, I think, not only from the situations that we talked about earlier in terms of appearance and dress code, but also the way they conduct themselves with clients and with you and with each other in the unit. So that's very important, and you're in a great position to be able to recognize that and offer prompt, productive feedback on that. Safety is an ongoing consideration, and I know we tend to address it in our clinical conferences because there are so many aspects to safety, not only in terms of locked units, but in terms of medication administration, in terms of milieu management, the whole gamut. So once again, you're always in tune with safety, and it would be very beneficial to just discuss some aspects of that when it comes up with your clients. Each of the competencies are labeled as knowledge, attitude, or skills. So knowledge, of course, is the clinical knowledge. What do they know? Attitude is, again, the perception and the value judgment that goes with it. And then there's skills, the ability to carry out a plan or an action. Now, we use an online progressive clinical evaluation tool, and it is on Google Drive. So it's completed every week and as soon as possible after the second day of the clinical. And it's used as a Likert scale, 1 to 4. So 1 is unacceptable, 2 is needs improvement, 3 is satisfactory, and 4 is very satisfactory. So these are some of the things that we'll be discussing again when we meet before the semester begins. There are many ways to access the Google Drive in terms of going to the NMHS.org email account, or sometimes we discuss other options for conducting that feedback. So competency evaluation, again, competency is measured with a 3. And the student demonstrates satisfactory achievement. So that means that their performance is safe. And when you're discussing it with them, they can demonstrate that there's been some synthesis going on in regard to what they've learned and how it equates to nursing care and nursing actions. And with a level 3, the student functions with minimal guidance. They're able to step in and do things. They might have some questions, but overall they're doing pretty well. Now, a competency level of 1 or 2 or 4 requires a comment in the comment section. 2, as I said, means needs improvement. And you see that in 1 week, and if the student doesn't improve after receiving that 2, then the next week they would get a 1, meaning unsatisfactory. And an unsatisfactory carries more weight, I guess, than a 2 because it shows that the growth isn't happening. And so that's an area then that we need to discuss with the client or the student and make a plan for rectifying. And a level 4, of course, is excellent for the student who goes over and above and beyond what you would expect of a student. Typically that doesn't happen until later in the rotation when the student has become more confident in their role and also more confident in their setting. So they have a better idea of what's expected of them and what their resources are. Students can be very innovative when they feel comfortable and supported, and that's when you're most likely going to see them achieve a level 4 in some aspect of client care. Now, with cultural competence and communication and caring, again, we're looking at these in terms of attitudes, demonstrating caring behaviors. We're looking at it in terms of skills, and we're looking at it in terms of knowledge, in terms of knowing how to communicate effectively within the healthcare team. And so these are all areas that can be evaluated by the DEU faculty. And again, we expect to see the students contributing in clinical conference. However, typically, because you're involved in the patient care unit, you won't get the benefit of observing that. But I think you will see that it's happening just because they seem to be processing more quickly or have a newfound understanding of what's going on around them. For clinical knowledge and critical thinking, again, this could relate to assessment techniques. It could relate to knowledge and demonstration of skills, such as maybe doing an appropriate CWA or an appropriate EPS assessment, or even being able to assess mood and affect and thought process. It would also equate to making accurate assessment data and responding to changes in the health status. So you can see that there's a lot of potential areas for the student to demonstrate clinical knowledge or critical thinking. And as they continue through the course of their rotation, I expect that you will be seeing the student doing these things increasingly and with less direction. Management of responsibilities. One of the things that I think you are in a position to see very clearly is showing initiative and readiness to act on new opportunities. And that is one of the characteristics in their clinical evaluation that you can evaluate on a 1 to 4 level. And initially, many times students are reluctant to step in, they're unsure. And that might happen once, but we can't let it continue to happen. We want to see them take some initiative. We want to see them feel ready to act in a new situation. And again, prioritizing, we've talked about that before as well as documenting in a timely manner. Sometimes students are so caught up in what they're doing with their clients or the conversations they're having that they don't necessarily remember that they need to stop and document some aspects of that conversation or some of their observations. And that's one way of managing their responsibilities. Students will be developing a nursing process care map. It's done as a care map rather than one of those old-fashioned 30-page care plans. And it's a clinical assignment. And they might ask you questions about it or about some aspect of it, and that's fine. Typically, they're doing this nursing process on a client that they've been working with in the unit, so you might be a good resource for that. And then, of course, with the nursing process, we've got the nursing diagnosis along with outcome and indicators. Professionalism, again, accountability for actions, and seeking assistance is necessary. There's nothing wrong with asking questions or seeking clarification. It's when they don't do that that there's probably going to be some negative consequences. So the fact that they're seeking assistance or seeking clarification is a good thing. And we do want to see them stepping in to work as part of a team. One of the ways that you can support that is by actively directing them. Our team is doing this. Come with me as we do this. So that you're just including them and they're seeing what you're doing and they're recognizing now how they might be able to fit into this process as well. So completed by the DEU faculty, again, arriving to clinical in a timely manner, getting their paperwork in, following the dress code, and we already have talked in the past about confidentiality and HIPAA guidelines. So all of these are aspects that show up in their clinical evaluation tool. Safety and technology. Again, this would include safe administration of medications, using clinical technology with minimal guidance. And I think you will agree with me that our students typically are pretty comfortable with technology, and they're very able to search out medications and find the side effects or find the teaching needs or associated data. So they usually know how to use their resources, but sometimes they might not. So that's, again, an opportunity to remind them. If you're seeing that they're not getting the information they need, ask them what they need in order to be able to access that. And then the Google Doc is what we use for evaluating student performance, and it's a clinical evaluation tool, which you'll be seeing portions of shortly. But sometimes what seems to work well, if you're particularly busy or not able to get to the Google Doc, would be to select, say, 4 or 5 of the evaluation categories and then rate the student performance. What's important, not only with rating the performance, but what's even more important to that is giving an example to support the rating. If you gave them a 2, what did you expect to see that you didn't? What was the problem? What did they miss? Or if you gave them a 4, what did they do or say that indicated that they were doing better than average? Again, that kind of feedback is so important for the students. So we need to support the grading that we give them in their clinical evaluation. We'll be talking more about that evaluation tool shortly. So this concludes this portion, and we'll be continuing on shortly. Thank you for your time and attention.